is Sergeant First Class Frank Chavez. Today I will be giving a briefing on ethics in the medical field. Ethics in the medical field play a large role in today's society. Ethics gives certain guidelines that professionals in the medical field hold firm to. Ethical dilemmas or perceived violations of ethical codes can result in public outcry, job termination, and criminal charges. Especially for us that we work in the medical field, it's very important for us to know that. Potter Stewart once said, ethics is knowing the difference between what you have the right to do and what is right to do. In the medical field, healthcare workers can come across multiple situations where their own professional codes are sometimes questioned, their motives are questioned, or they get put in a predicament where they have to make a decision whether it's right or wrong, but it has to be the right decision ethically. The series and application of ethics into the medical field create a basis to provide care for an individual. The theory of utilitarianism holds that one should act to do the greatest amount of good for the greatest amount of people. The concept of equal distribution of medical supplies to the affected population also falls in line with that theory. Deontologism is a theory that any act can be prescribed as being good and acceptable if the act can be universally given to everyone. Universality is based on the concepts of duty, justice, respect, and the right that one can make to their own choices. For example, there is no reasoning behind I made the decision ethically because it was for the greater good. Sometimes you have to do some, like they like to say, do a little bit of evil for the greater good. That concept does not apply in the medical field for us. Ethics leads to moral and legal rights in the medical field. A violation of moral right based on what society believes are good and bad actions. A violation of legal rights is the disregarding of a legitimate established law. Ethical principles, concepts, and violations in a healthcare setting. Autonomy is the concept that an individual can choose, act in a matter as they deem fit. One does not need to take medication or have a procedure done if they do not wish to do so, unless the person gives the consent. Informed consent is giving one's permission to submit oneself to a medical procedure, research, study. Now, the reason this is important is because in the past there have been studies in the medical field that have violated people's ethical rights. A good example would be the 1942 Tuskegee syphilis study. It's a prime example of a principle of informed consent where it was violated. So pretty much a group of personnel were brought in under the false pretenses that they were going to be tested for bad blood. In turn, they were actually contaminated with the syphilis virus. At that point, they were held and signed consent forms, which they were not privy to prior to the study taking place. As the study progressed and the personnel got worse, they actually found a cure for the syphilis. However, they were never informed of that. So after the fact that they were given after the fact that they had already been infected, they went on and let these people stay with the syphilis, and even after the fact that they had found the medication for it, just to see what the outcome of the study would be and to see what the effects of the syphilis would be on the people without their consent. A violation of one's medical privacy is also considered unethical. The releasing of one's personal information without previous consent is a reasonable example of this. Today's institutes have their employees take training courses to ensure they understand what constitutes as a violation of a patient's privacy. So for us, we all know that we practice HIPAA, right? We're all familiar with the HIPAA. When we all came on board, we had to do our 1-hour HIPAA training to ensure that we had proper training to ensure none of these ethical violations to other personnel and our soldiers were violated in any way, shape, or form. The concept of death and dying has also been a controversial topic, especially with suicide, like Dr. Kevorkian, assisted suicides for people that are terminally ill. During Hurricane Katrina, 4 patients died in the Tenants Memorial Medical Center. They died from overdoses of medications that had been not prescribed to them. The doctor was arrested because of these killings were found not ethically correct. His justification was that they were mercy killings because of the situation they were in. One of the most important ethical codes of conduct has been established in the medical field is the Nuremberg Code. The Nuremberg Code of Ethics was established post-World War II during the war trials after it was discovered that Nazi medical personnel were doing involuntary human subjects in the name of science and medical research. Now, we all know if you do your research on Nazis, at the time they were, one of the biggest things that Hitler was pushing was to create the perfect species or the perfect human being or race. So they were doing unethical medical surgeries, trying to take body parts from other people and sewing them on to other cadavers to see if they would actually take. Parts of the Nuremberg Code of Ethics include the experiment should be also conducted as to avoid all unnecessary physical and mental suffering and injury. The degree of risk to be taken should never exceed that determined by the humanitarian importance of the problem to be solved by the experiment. And no experiment should be conducted where there is a prior reason to believe a death or disabling injury will occur. So overall, in the medical field, we need to keep in mind that we have an ethical duty based on what we do, and we strive to maintain our ethics, moral codes, and principles regardless of whatever the situation may be. Thank you, that's all.